Going to start by making sure you and your family celebrate safely tomorrow. The Department of Family and Protective Services says most drownings from this year alone have happened here in Harris County. I'm joined now in studio by UT Health McGovern Medical School Associate and Professor Dr. Hilary Fairbrother. Good morning to you, Doctor.
Good morning.
Thanks for joining us. What are things, we'll get right into it, what are things that people need to remember around a body of water?
So I do want to emphasize that even if you can swim, we all have to respect water. And drownings happen every year. In Texas, there are many drownings. It's not all just little children. Sometimes it's older people who get tired, and sometimes it's people who are young and healthy, perfectly able to swim, but intoxicated, or people who have hit their head. So we all need to be very respectful around water and really make sure that we're being aware and being responsible as we swim and enjoy water this 4th of July.
If you're out near a body of water with your family or friends and there's an emergency, what should you think about maybe having on you as sort of a proactive plan?
I think the most proactive plan is to make sure someone's got a cell phone nearby, and so that they can quickly call 911. Oftentimes when we're by a body of water, we're farther away from a hospital, so it's going to take longer for a paramedic or an ambulance to get to us when we call for help. And then second, just really being aware, making sure that someone always has eyes on whoever's swimming in the water, particularly as it pertains to children. So I always like to appoint a family lifeguard, and that person's only job is to watch the water until they're replaced by another family lifeguard.
Good advice there. If you see someone who's in trouble, you sort of already touched on this, what's the first thing you should do? You mentioned the cell phone and then having a family member or a friend sort of have their eyes on the water.
So if you see someone in trouble, the number one thing is don't jump in to save them unless you yourself are a very strong swimmer. And we see this most tragically when someone's trapped in a tide, let's say in the ocean or in a body of water that's moving quickly. So don't jump in unless you really feel like you are a strong enough swimmer to actually help the person in need. And you can always throw them something that they can use to float on while we go to get them help, particularly in the ocean. If you are a strong swimmer and you do decide to go rescue, just know that your number one job is to stay afloat with that person, not so much to reach shore. You're just trying to keep things safe for the moment, and then, you know, if possible, drag the person to the shore. If they're not breathing and they're unconscious, you would want to give some rescue breaths and start CPR.
Okay. We've seen an increase in the number of heat-related deaths around the country as well here. What's the difference between heat stroke and heat exhaustion?
So this is really just kind of a spectrum of disease, and heat exhaustion and heat stroke are really only delineated by two things. How hot is your body inside, and is it affecting your brain? So when we talk about the symptoms of heat exhaustion, that's just nausea, dizziness, not feeling well, flushed skin, sweating. And then what happens as it proceeds to heat stroke, the body temperature gets more elevated and the brain is affected. So now you have people who are confused, they might have a seizure, and they might be unconscious. You
touched on the symptoms. How can we help somebody who is dealing with, say, heat exhaustion?
So if someone's really hot and they're not feeling well and they're having those kinds of symptoms, the number one thing is get them out of the sun, get them into the shade, or get them someplace cool with air conditioning, get them some water. A lot of times people are nauseous and they don't want to drink, so you can spray them with water, take off restrictive clothing, and really get them out of the heat and out of the sun and start getting them hydrated. If someone's confused or had a seizure, they need to go to the hospital.
Okay, good advice. Thank you again, Dr. Hilary Fairbrother. Thank you for joining us.